Hello everyone, this is Dr. Ruxana Kushtar, Consultant Obstetrician and Gynecologist at Ovum Women and Child Specialty Hospital, Kalyan Nagar, Bangalore. Today we are going to discuss how to safeguard our breast health. The reason I chose this topic is the incidence of breast cancer is rising by leaps and bounds every passing year. And you will be startled to know that it is projected that by 2025, 1 in every 28 women in India is likely to have breast cancer. And surprisingly or unfortunately, the incidence is even more in the urban population, as high as 1 in 22 women is likely to have breast cancer by 2025. Now, why is it that the breast cancer is rising so fast? It has been projected that it is because of the poor lifestyle which is followed by urban women and excessive body weight. Like for example, the number of women who are having alcohol, smoking, lack of sleep, stressful life, late pregnancy, unable to conceive, that is infertility, unable to breastfeed the child because of job pressure or whatever, all this has possibly led to the increased incidence of breast cancer. Having said that, we should also be aware that even in the absence of all these risk factors, any woman is likely to have severe breast. So what are we going to do about it? We should know how to detect this cancer very early and treat it. Because if this cancer is caught early and treated, the cure rate is very high and the survival rate, the 5-year survival rate is very high. What I mean to say is at the end of 5 years, if we see the number of women who had breast cancer and got treated, 99% of them will still be alive if treated alive. And that is a really heartening incidence. So how are we going to catch it early? The first important thing is self-examination of the breast. All of us should get together and make a resolution that we are going to self-examine our breast once in a month. So there are a number of videos available on the YouTube which shows how a woman should be doing self-examination of the breast. I would just like to touch upon 2 important things which I have seen a lot of patients do mistake in my practice. The first thing, use your fingers to feel your breast and not the palm of your hand. And the second thing is, it is better to do self-examination on the 4th or the 5th day of your periods, because that is the time the breast is likely to be least tender. So why do we need to examine our breast every month, every often? Like if each of us get into the habit of knowing how our normal breast tissue looks like, it's very easy for us to detect if there is any change. Like if there is a change in the consistency, the change in the feel of your breast, we can catch a lump early. And also, look into the mirror to see your breast, if there's a change in color, change in appearance, change in size, if there is a puckering, if there is a different feel of the breast. So if we do find any of this, go to your doctor as early as possible to further investigate the matter. And don't panic, because all lumps are not cancer. So breast examination is very important. And the next thing which can detect the cancer at an early stage is what we call as a mammogram. Mammogram is a special type of breast X-ray which catches the disease at a very early stage. So all women above 40 years are recommended to have a mammogram, and few women who fall into the risk of high risk category are recommended to have this mammogram even before 40 years. Your doctor will guide you accordingly. Just like how we have our birthdays, our anniversaries, our Valentine's Day, I think all of us should fix a date for our mammograms, especially over the age of 40 years. And if you belong to a high risk. High risk in the sense, if any of your siblings, your mother, your daughter, your aunts, any of them there's a family history of breast cancer, it's strongly recommended to do mammogram even if you're not 40 years old. So, does the self-examination and mammogram prevent you from having cancer? No. We cannot prevent, but as I said, detected early and treated early, the chance of cure is very high, or at least the 5-year survival rate is very high. It's almost as good as in a person who doesn't suffer from breast cancer. So take care and goodbye.